My name is Sonal Chandalia. I'm the Chief Nutritionist and Diabetes Educator at Dr. Chandalia's Diabetes Endocrine Nutrition Management and Research Center. Friends, today we are going to talk about how to manage your insulin therapy, how to manage your diet, how to manage your exercise, and the triad connection between the three. It's very important to know that your glucose monitoring is the sole most important factor that will keep everything in balance and also prevent complications. This glycemic control is extremely important. Now, how do we achieve this? To achieve this monitoring, we usually recommend is a self-monitoring of blood glucose, which is like a home glucose monitoring for an individual. And you find that when you see in this chart, in the initial phase, when it is initiated, you'll see that we are asking for frequent readings. We follow usually a 9-point profile where we ask you to stagger the readings later on and less frequent later on. But initially, do not be surprised if your healthcare professional or your diabetologist asks you to maintain a chart which has the readings which are more readings per day, but in a staggered fashion so that over a week, we are able to get a trend of how your readings are doing in the initial phase with the medication that has been begun. After a while, that is eased off and you'll find that we will have spaced it out much more, and hence you will be able to see that after a while, those particular timings or those particular readings, whether they're pre-meal, post-meal, they may be fasting, they may be 3 a.m., will get stabilized and will not need that frequent monitoring. So we spoke about the home monitoring, that is the self-monitoring of blood glucose, but there is also another parameter that we have to keep track of, whether between the diabetologist and yourself, is the HbA1c targets, which is essentially your 3-month average. So usually in a type 2 diabetic, as well as a person who is initial 2 to 5 years of the disease, we find that we need to monitor, we need to make sure of the glycemic control every 3 months, so that we are looking to prevent complications and keep the situation stable. After about 5 to 10 years of the disease and greater than 10 years of the disease, you also have to look into the complications that may arise, that is cardiovascular, renal, retinal, neurological complications, and hence the HbA1c targets may be settled accordingly. So they will be decided depending on the need, depending on the risk factors associated with your disease, with your diabetes, or your other complications that may be associated with it. The targets will be maintained, but usually a less than 6.5% HbA1c is normal. Then you could be on the threshold, then it could be almost like a pre-diabetes, and beyond that it is diabetes. Whereas in a type 1 diabetic, it may find that there is standard insulin therapy, there may be intensified insulin therapy, there may be insulin pump therapy on. So the targets that are maintained are a little different and they have to be reflected accordingly. They will be decided accordingly so that we prevent the microvascular complications in the type 1, which tend to happen earlier. Similarly, in pregnancy, or whether it is gestational diabetes or whether it is a type 2 diabetic with pre-gestational situation, those targets will also be decided accordingly for pregnancy. And in a type 1 diabetic, therefore a type 1 diabetic with pregnancy also will have certain different target values for HbA1c. All these will be as stated, they are known to healthcare professionals, and you have to ensure that you follow these targets as they are set by them. Now, it also depends on the type of insulin preparations. So, there are 4 main types of injected insulins that are available or preparations available. They basically are classified on the basis of their time of action and the time of when the action stops. So, you have the ultra rapid acting, short acting, intermediate and long. So, it's basically the profile is on that basis. And when you see it, you can understand that this action profile is very important to note. Because as an individual with diabetes, and if you have any other complications also, you need to know that what is the particular action of your insulin begins, when it peaks, and when it is going to wane. If not known, you will not know how to time your food intake, your exercise intake, and then you either land up in hypoglycemia or hyperglycemia. So keeping this in mind is very important when you're doing your daily activities. So we then move to the diet and the physical activity. Now, the diet, we have to consider the meal timings, the timings of the meal, the menu of the meal, the physical activity that you are taking. All these are important. As individuals with diabetes, it is very important to understand hypoglycemia, because when it occurs, it can be very disturbing to an individual. So, hypoglycemia is essentially when there are low levels of blood sugar, when the symptoms commonly occur, usually below 70 milligram per dl, and absolute fine point is actually below 68 milligram per dl, but below 70 also symptoms can be experienced. Now the causes can be many. It can be that sometimes the excessive medication or the insulin dosage is high and hence there is a hypoglycemia. And a very, very pertinent one is low food intake, which may be due to diarrhea or vomiting, which is most common because there are a lot of sometimes intercurrent illness or infections that one may have, and those tend to cause difficulty because there is no food intake and you're losing fluid as well as food either through vomiting or diarrhea, and these are the ones that need to be addressed and one needs to know how to remedy these immediately. It can be also due to severe physical exercise, so you burned up a lot of calories and sugar and you run low. It could be in the situation when one has any liver or kidney disease, so it affects the metabolism. It can be also sometimes due to certain drug-to-drug interactions, mainly sometimes like anti-malarial drugs or a sulfa-based drug or an antibiotic like ofloxacin. They could cause some difficulty and cause hypoglycemia. But another very common one is an alcohol-induced hypoglycemia, where any consumption of alcohol may cause hypoglycemia in the short term, but in the long term, it will cause hyperglycemia. But we need to consider it that it's not even okay in short term to have any alcohol consumption when you have diabetes without having any food accompanied with it if there is any social drinking that is happening. Now, what are the symptoms of hypoglycemia? The symptoms always vary from mild to moderate to severe. In the mild symptoms, you'll find that you'll have some shivering, you will have some kind of irritability. You may also have that as an individual, you feel that you are not able to really navigate your way somewhere and you just feel this kind of emptiness in the stomach, and you need to know that at that point, if you remedy it, it will not become moderate or severe. But the progression of hypoglycemia can become more difficult to be treated if it is untreated, where abnormal behavior can start because the cognitive functions get affected. There can be drowsiness in an individual. There can be semi-conscious or unconscious state and sometimes even convulsions. Now, one must remember as an individual who's taking either medicines for diabetes or even on insulin, that some even drugs or medicines of diabetes can cause that hypoglycemia. Now, there are much more newer drugs which tend to not cause hypoglycemia. So, when one is taking and being treated by insulin, one has to definitely take care of preventing hypoglycemia in different conditions. Let us allude to understanding hypoglycemia with exercise. Now, before exercise, it is very important when you're on any medication already for diabetes that you consume a small snack or a fruit to prevent any hypoglycemia that might occur while you exercise. So, it's better to have something before you actually start the exercise. Also, measure the blood glucose level at that time and you have to ensure that you're not already running low. Next, during exercise. Sometimes there is a long, prolonged, extended time of exercise or a certain sport or any competitive sport. Then you would need to know that you'll have to have an additional small snack an hour after that particular activity if it's going to extend for a longer time, because you're burning the glucose very fast and you need to have certain input of glucose. Post-exercise effect is something that many may not be aware about, that hypoglycemia can occur up to 12 hours up to post-exercise because there is an exercise layover effect that continues. So it is important to consume a snack or a meal within the 2 hours or immediately after a particular exercise, because you're preventing hypoglycemia for the next 6 to 12 hours. You may suddenly dip not realizing that it is owing to the exercise that you did in the past 12 hours. And that's why it is important to have that meal or snack post exercise. You're not only preventing that particular hypoglycemia, but you also have to replenish the food intake because you need to make sure that you're getting again carbohydrates and protein to again find the balance. So when you look into hypoglycemia, when you have diabetes, the best medicine is really to try and prevent it. So one important concept that you need to keep in mind is that you monitor your blood sugar regularly as you have been asked to, and keep it within the target range and let it not have many frequent hypoglycemia or low values. You have consistent meals and do not delay or miss any meal. You have to adhere to the medication that is prescribed at the time because it is timed with your food and your activity. You have to also adjust your activity depending on the medication and your physical activity time. And that activity time it is to be undertaken at a particular time. You ensure that your medication is otherwise tweaked with the help of your diabetologist. Alcohol awareness has to be there. The best is usually to avoid, but if there is any social drinking, then it should be accompanied with certain healthy foods or healthy starters to prevent hypoglycemia. And some additional tips that we may consider are that you must record on your self-monitoring of blood glucose and keep track of all your low values and bring it to the notice of your healthcare professional so the pattern can be identified so that it can be rectified. And you must carry an ID on you for any emergency situation, especially when you're on insulin. If one does land up suffering from hypoglycemia, it is important to know how to treat it right to prevent recurrence, and the remedy has to be understood. So if the value drops below 70 mg per dl, then the following steps should be undertaken. Usually a small portion like a 15-gram carbohydrate snack can be consumed, which can be a sandwich and a fruit. And then you wait for 15 minutes and you again check your blood sugar levels. If the symptoms persist or the blood sugar is still remaining below 70 mg per dl, then you have to treat with another portion of food intake, which will be a 15-gram carbohydrate kind of snack or a small meal. This is important to bring it back to normal target level. Now, the treatment of hypoglycemia can be done with very simple things because some of these you need to have as carry foods or have them on you so that wherever you are, you can treat that hypoglycemia. So, you roughly need about 5 or 6 pieces of regular hard candy which can be eaten, which normally children eat. And we find that that helps remedy, and it's an instant intake of glucose. The uptake is very quick and so it remedies very fast. Or at least have one fruit. Or if you need and you have the source of some regular water, then you could put a tablespoon of sugar, that is 3 teaspoons of sugar, 15 grams in water and have it. But the best remedy are the first two, is to have hard candy or a fruit to remedy it stepwise. So we must remember that any of the drinks which are sweetened, which are with the sweeteners, are actually not the ones that can remedy, which are like the diet drinks. So please don't go for those when you're trying to remedy a hypoglycemia. Another very important feature is of a glucagon kit. Many times this can be administered if there is severe hypoglycemia, the person is almost unconscious, not able to swallow and able to help themselves. Then an intravenous glucose administration may be given to unconscious individuals, and usually this glucagon kit or what we call a hypoglycemia kit is usually kept at your healthcare professionals, or it is something that if you have very severe episodes, then you should also keep ready with you. So this recovery usually typically can occur within 15 minutes, provided that you are having easily digestible food post recovery, and so you will not again fall back into a hypoglycemia. Now preferable sometimes is there is the oral glucose first, then an intravenous glucose over the glucagon, which may be the last resort because that may take 10 to 20 minutes. But in a person who cannot consume anything, the glucagon kit becomes very important. As we mentioned earlier, it is sometimes the vomiting or the diarrhea in a sick day routine where you develop that due to some food poisoning or some indigestion, then you're unable to eat or retain the normal meals, then a sick day routine must be understood and followed. You take your daily dose of insulin, but you never omit the insulin. But what may be done is that you test your urine for ketones and you test the blood glucose also every 4 hours, and you keep track so that you're taking your dosage accordingly. And therefore you find that if the urine glucose, or you find that the ketones is already present, or you find that the sugar is above 200 milligram and then you have to test for ketones, you may make sure that you contact your healthcare professional so that accordingly for that hyperglycemia, if it is present, then there is an additional dosage of insulin that may be required, but it has to be administered and be advised very carefully. What one has to keep in mind is that you take liquids every hour. If you're not able to because of nausea and vomiting, then frequently sip it very frequently. You have to rest and keep warm because you should not be cold, as the body will also have a reaction when your body is very cold. And if vomiting or in pain or any other difficulty, and if you're too ill to follow anything, then please ensure that you contact your healthcare professional. At that moment, you may drink or have anything that you can tolerate. But at the same time, you have to remember that if you use fruit juices, use regular soft drinks, tea, etc., again your insulin dosage or your medication dosage will have to be adjusted according to your situation. So to prevent hypoglycemia in such a situation, the dosage may sometimes be reduced, or that extra insulin dosage will be reduced so that you do not land up in hypoglycemia because of lack of eating. So you can oscillate between a hypoglycemia and a hyperglycemia, but specifically for hyperglycemia, where the dosage will be cut down and then you're regularly monitoring your blood glucose, and after that the dosage will be brought back to normal when you have normalized. So these are some of the symptoms that you need to understand and follow, as well as take care of yourself in a sick day routine to prevent the hypoglycemia.